As we said at the end of the last movie, we're going to continue to talk about health risks over a 10-year period and per 1,000 people. The 10-year time frame is arbitrary, but it makes sense to us since it's a time frame that's easy to imagine and it allows time to do things like change your lifestyle to reduce your risk. So if you're an average adult over the age of 45, your risk of colon cancer is about 5 in 1,000 over the next 10 years. But why did I mention being an adult over 45? Disease risk generally increases with age. That is, your risk at 60 is greater than your risk at 50, as you can see in this plot of the increasing risk of colon cancer with age. We've been focusing on colon cancer as we've talked about risk. We now want to compare risks for different diseases, and since people are most concerned about dying from a disease, we will focus on risk of death. Remember, a 45-year-old's risk of getting colon cancer is about 5 in 1,000 over the next 10 years. Even though people tend to think getting cancer is a death sentence, not everyone who gets cancer dies from cancer. The 10-year risk of dying from colon cancer for a 45-year-old is 1 in 1,000. We want to be able to talk about the risk of any condition in relation to other important diseases. A reasonable approach when comparing disease risk is an age and gender-related 10-year risk of death per 1,000. We've already shown you why age is important, and there are also differences between men and women in risk of death from disease. Here are 10-year risk of death per 1,000 for women aged 35 and 50. The numbers don't add up to the chance of dying for all causes because there are many other causes of death besides the ones listed. Comparing these numbers, you can see that the numbers are higher for 50-year-old women, and higher still in 50-year-old women who smoke, the numbers in parentheses, when compared to non-smokers. Smoking, along with age, is the most important risk modifier, and it is something each individual can control. We are going to show you a series of remarkable charts of risks created with lots of effort by physicians at the Veterans Affairs Outcomes Group and the Dartmouth Institute for Health Policy and Clinical Practice. They published these charts in the Journal of the National Cancer Institute in 2008. The title of the article is "The Risk of Death by Age, Sex, and Smoking Status in the United States, Putting Health Risks in Context." The researchers point out that, quote, "To make sense of disease risks they face, people need basic facts about the magnitude of a particular risk and how one risk compares with other risks." Unfortunately, this fundamental information is not readily available to patients or physicians. We created simple one-page charts that present the 10-year chance of dying from various causes according to age, sex, and smoking status, end quote. The data we just showed about 35 and 50-year-old women came from one of the charts, which are much more detailed as you can see here. You will use these charts to answer some of our questions. Adults 35 and older can use them to compare their own risks for 10 to 12 important serious diseases that are responsible for a large portion of all deaths, the diseases one would like to avoid. If, like Dogbert, you're confronted by messages about risk, you need to know the context. Who is at risk, the age group and the gender, the risk of what, getting a disease or dying from a disease, and how does this compare to other risks? Knowing the questions to ask when faced with a risk number will allow you to make well-informed decisions. Check your understanding by returning to the Moodle and answering our questions.